like to tell you about a patient I had a few months ago, and this is the kind of case that really causes me concern. On that day I was the duty anaesthetist in the orthopaedic acute operating list. So I was looking after patients, giving them anaesthetics for those patients who needed broken bones to be fixed. And the patient I next saw was a 78-year-old lady who had a broken hip, needed surgery to fix that. So I went round to the pre-op room to make my anaesthetic assessment. I quickly began to be concerned. This patient was really quite confused and obtunded, and when I held her hand it was freezing cold. She looked quite dishevelled, so I picked up her charts and made a note of her observations and discovered that she had been in hospital waiting for surgery for 4 days since she broke her hip. In each of those days it's very likely that she was kept nil by mouth, not allowed to eat or drink, and waited all day futilely for surgery, only to be told at the end of the day, "I'm really sorry, but the theatre was busy and we didn't manage to do your case today." So this had happened each day. She was starved, waiting, and this was now the 4th day of waiting for surgery. She was really in a poor condition after 4 days in hospital. She looked quite dishevelled. It looked as if her teeth hadn't been cleaned in all that time. The bed linen was rather soiled, and she felt very cold. I checked her observation chart and found out that in fact she was quite profoundly hypothermic. And more concerning than that is that for at least 36 hours, the nurses had carefully recorded her temperature on the chart, 35.5, serious hypothermia, but it appeared that they had not done anything about that at all, and that writing the observation was more important than fetching a warm blanket, for instance. I began to imagine if this patient was my grandmother, that I would be deeply concerned and upset about her state after 4 days in hospitals and the suffering that she had had unnecessarily. And I began to wonder about the inhumanity of a system that starves a patient day after day, leaves them neglected, cold. She was in a lot of pain. She had not had adequate pain relief with a broken hip. But as an anaesthetist, I had other concerns too, because I knew that mild hypothermia in an elderly patient just very dramatically increases the risk of complications. This patient was at 3 or 4 times the normal risk of having a cardiac complication during anesthesia and surgery. The hypothermia was a very large risk factor for post-operative infection. She could get an infection in her wound that might prove to be fatal. She's malnourished, so I know that her healing and recovery is going to be slow. She's going to spend a long time in hospital. Her needs for rehabilitation are going to be very great. So I'm thinking that these neglects of the basic human needs, to keep someone warm, to keep them comfortable, to care for them, to relieve their pain, to clean their teeth, that these basic human needs, that the neglect of those is really costing our system very dearly. When I see patients like this, when I see their suffering, these are the kinds of things that have motivated me to try to change the healthcare system. I just feel a degree of empathy and concern, and when I see things like this, it makes me feel deeply upset, and I feel we just have to do something to change the system, that if this was my grandmother, that this would be completely unacceptable care. I think the reality is that our healthcare environment has got so busy and so stressed that people tell me they just don't have time to care anymore. The research shows that nurses come into their profession with very high ideals of whole person compassionate caring, and within 2 years, such are the pressures of the system, the focus on tasks, the busyness, the competing demands, the kind of unwritten rules of the institution that says just put your head down and get the job done and don't make a connection to your patients. These are the things that are really leading to high rates of burnout and depression, and many nurses are job hopping or leaving their profession altogether. For doctors, it's not much better. The figures on rates of burnout for medical professionals around the world are really scary. In the United States, a survey of 12,000 physicians, 78% of those doctors said that the practice of medicine was no longer rewarding or was less rewarding than it used to be. And fully 60% of them said they would not recommend medicine as a career to their children. They're so disenchanted with the daily realities of their life and the system they're working, they would persuade their children to follow a different career. That's a tragedy. We have to do something about rehumanizing the system to give people back meaning and purpose and joy and satisfaction in their work in healthcare. Why are health professionals feeling so discouraged? Why are there such high rates of burnout? I think the reason behind this is that healthcare has become dehumanized. There was a time when we could only examine the outside of a patient and we had to treat the whole person. And now with advances in medical technology, we're focusing on ever smaller and smaller parts of the human body. And instead of treating a human being, we're just treating a medical condition. So for condition X, we need to give treatment Y. Another reason I think that healthcare has become dehumanized is that we don't really have a health system, we have a sickness system. So in our model of medicine, we focus almost exclusively on disease, on risk, on illness, and we don't focus on wellness or well-being or what resilience or strength the patient could bring. The consequence of that is that when we focus only on treating disease and not the person, is that the treatment becomes impersonal. The person we use, Susan Jones, becomes the breast abscess on Ward 6. We start to objectify patients. We also know that emotional and psychological health and positivity have a huge positive impact on physical health, so that patients who are optimistic and happy live much longer and have much healthier lives than those who are sad and depressed. So we need a really fundamental shift around, not just to treat physical illness and disease, but to treat the whole person in a holistic sense. And when health professionals connect to treating person as a whole person rather than just treating disease, then they find so much more joy and satisfaction in their work.